The United States is not going to be immune to this outbreak, and I'd like Dr. Fauci to tell us what's anticipated for the United States as we face the coming threat of the mosquito and Zika.
Well, we certainly will have many more imported cases. We already have well over 100 imported cases right now. We have local transmission in Puerto Rico and in the Virgin Islands and American Samoa. What likely will happen is that we will see something similar to what we have seen in the past with dengue and with chikungunya. When you have the amount of imported cases that we almost certainly will see, I think people don't fully appreciate that on any given year there's between 30 and 40 million people go back and forth between the United States and South America, Central America, and the Caribbean. Among those are an awful lot of pregnant women, for example, but there are all people who are not pregnant. They just keep coming back and forth. So we're going to have more and more imported cases. When that happens, you almost inevitably, particularly in the part of our country, in the southeastern part, in the Gulf Coast, Texas, Florida, and others, we will see local transmitted cases. If it acts like dengue and chikungunya in the past, those local outbreaks will be well controlled by an aggressive mosquito control program, because we have seen both. We've seen dengue outbreaks both in Texas and in Florida, and we've seen a chikungunya local outbreak in Florida, all of which were suppressed. We can't say for sure that we're not going to have a major outbreak in the United States. I do not think we will, but we will be prepared for it anyway. But I don't think, given the conditions that we have in this country, that we're not going to see a massive outbreak. But I think the domestic local outbreaks are going to cause a great deal of concern. And I think we need to be prepared to be very, very vigorous in getting correct information out to the public. Because as we know, and I was part of that need to do that and communicate, in the Ebola time, something like 2 nurses who got infected in a hospital in Texas created an enormous panic in the United States. So we need to be prepared to continue to give out correct and measured information to people.